Hi, today we're going to talk about needle cricothyrotomy and the use of our new jet insufflator, the VBM Manujet 3. So the first thing that I'm going to go over is the actual catheter, and we have 3 of the catheters in the Manujet kit itself. This is just a demonstration of one of them. So you see it has a simple adapter mechanism, so if you want to put a ventilator circuit or a VBM on, and you can also use the lure lock adapter in order to hook up the Manujet, which I'll show you in a minute. So I'm not going to go over in too much detail how to do the cricothyrotomy, because we already did that in surgical skills lab, but I will go over the nuances of this particular catheter, and then we'll hook it up to the Manujet. So the first thing you're going to do is you're going to cannulate, and you can either use air or a few cc's of water in order to aspirate. And if you see bubbling, if there's water in there and you see bubbling, you know that you've got air and you're more than likely in the cricothyroid membrane. So then you just pull the syringe off and then pull off the inner cannula and thread and secure your sharps. The other nice thing about this particular catheter is that it has a necktie in order to help to secure it. So we're just going to secure this necktie in place. And then what we can do is we can use a standard BVM and ventilate directly over the adapter piece. And when you're using this for jet insufflation, or you're using you're trying to ventilate through a needle, you're not going to get a lot of chest rise. Remember, your main concern is oxygenation. The other thing that you can do is you can ventilate on this lure lock piece with the Manujet 3, which is what I'll show you right now. So the Manujet 3 is going to come in this blue case, and we'll figure out where it's going to go in the aircraft. We've got one for each aircraft, including the fixed wing, and we'll figure out where this is going to go. But essentially what you have is you have the mechanism, and you have 3 standard cannulas. The blue one is used for the adult size. It's the largest. It's a 13 gauge. The yellow is used more for kids, and that's a 14 gauge, so smaller kids, school-age kids. And the white one, the smallest one, is a 16 gauge, which we're going to use for infants. The nice thing about that is the gauge on the Manujet itself is color-coded for infants, children, and adults. So color coding with the catheters correlates with the gauge here. So what you have is you have a piece of high-pressure tubing, which we will have an Ohio connector attached to each one. And then you also have lure lock plastic tubing inside the case itself. So what you're going to do is you're going to unravel the hose and hook it up to the oxygen cylinder, making sure you don't drop the Manujet. And then what you'll do in order to test it is adjusting it. The first thing you want to do is pop the dial open. There's an arrow there that shows you open. And then in order to increase the pressure, you're going to turn to the right, or the clockwise position, in order to increase the pressure, or you're going to decrease the pressure by moving it in the counterclockwise position. And notice we're dialing it all the way down. You want to start at 0. And then the next thing you want to do is you want to hook up your lure lock tubing, or your plastic tubing, and it's just basically thin plastic tubing. So you'll hook one side here, and then you'll notice that you have your lure lock piece right here that you're going to hook onto your catheter. So what I'm going to do is, since this is a child, I'm going to set it into the yellow zone. So again, I'm turning this clockwise, increasing the pressure, and I want to use the least amount of pressure necessary in order to get adequate chest rise and oxygenation. So I'm just going to start off at the lower end of the yellow because I'm going to be ventilating a yellow catheter. So I'm going to place this, twist that on, and holding that in place, I'm just going to push the trigger on the Manujet in order to provide ventilation. And if I don't get adequate chest rise, I can do a couple of things. I can increase the pressure by, again, twisting this knob to the right. And also notice on here, on this particular mannequin, and the same holds true with real patients, is that there's going to be a significant amount of air traveling out through the oral pharynx and nasal pharynx. So you might need help getting the mouth closed in order to ensure that most to all the air is traveling down to the in the right direction. And then just squeeze 1 second and allow 4 to 5 seconds of exhalation. And that's the Manujet. What we are going to do is, after you watch this video and get a chance to practice it a little bit, then you're going to sign each other off. We're going to have a competency written, sign each other off, and then we'll get it in the aircraft and in service, and hopefully you'll never have to use it. Thanks.